Okay, welcome and thank you for gathering here today for a momentous occasion, the launch of Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. I'm Councillor Chris Moyes, Chair of the Toronto Board of Health, and it is great to have so many community agencies represented and present for this significant milestone here this morning. Before we begin, I'd like to take a moment to acknowledge the land we are on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people. It is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. As a Caribbean Canadian, I am committed to continually acting in solidarity with our African, Caribbean, and Black communities, seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confront anti-Black racism, I pay tribute to these ancestors of African, Caribbean, and Black origin and descent. So the creation of this strategy has been a collaborative effort engaging the diverse voices of Toronto's communities. Through interviews, roundtables, and stakeholder-driven advisory groups, we have built a mosaic of perspectives, including those from community leaders, frontline staff, from multiple sectors, and individuals with lived and living experience of substance use and or mental health challenges. The accumulation of these collective wisdom is Our Health, Our City, a call to action for our entire city with a comprehensive plan to unfold over the next 5 years. This strategy builds on years of hard work undertaken by numerous City of Toronto divisions alongside community partners and leaders, including Toronto Employment and Social Services, Social Development, Finance and Administration, Shelter Support and Housing Administration, People and Equity, Toronto Paramedic Services, Toronto Police Services, and of course, Toronto Public Health. This strategy is a testament to the dedication of a united front in addressing mental health, substance use, and related challenges. Our Health, Our City is not just a document, it is a commitment to the well-being of every Torontonian. Dr. Davila and the team at Toronto Public Health delved into the intricate details of this strategy earlier this morning in a technical media briefing. Toronto Public Health leadership will formally present it to the Board of Health at our meeting on Monday, November 27th. Now, it's my pleasure to introduce Deputy Mayor Asma Malik, Chair of the Toronto Drug Strategy Implementation Panel, to share her insights. Mayor?
Thank you. Good morning, everyone. How's everyone doing? Yes, It is a big morning to be here together. Thank you very much to Councillor Moyes for taking us through the morning and for your leadership at the Board of Health. And thank you to Dr. Davila for taking us through the briefing this morning and for the incredible work of you and your team of Upala, of Sonia, Vanessa, Sana, and so many more countless members of Toronto Public Health to get us here today, and that incredible work that Councillor Moyes just mentioned. I'm Asma Malik, my pronouns are she, her, and I'm very proud to be Toronto's Deputy Mayor and be joined here as well with Board of Health member and Deputy Mayor Amber Morley as well. And I'm very proud to be City Councillor here in Spadina, Fort York, Ward 10, and to have been the chair of the Board of Health's Drug Strategy Implementation Panel since this past spring. And thank you all for being here and your leadership across the city now and for decades to improve supports and services that truly save lives. It is some of the most challenging work that there is, and it is undeniably important, especially in this moment. That's the work that we're building on here with this new strategy. Our City, Our Health is the city's new strategy for mental health, substance abuse, harm reduction, and treatment. And this initiative stems from the commitment of City Council and the Board of Health to promoting the mental health and well-being of every single Torontonian and to address the health and social impacts of substance use. The recent statistics are alarming. We've all seen them. Mental health issues are the leading cause of disabilities in Canada, affecting 1 in 2 Canadians by the age of 40. And while the evidence shows it, I know that we all see it and feel it among our communities and in our circles. Our Health, Our City recognizes the urgency to address this, incorporating recommendations shaped by extensive engagement with experts, community stakeholders, and individuals with lived and living experience. Acknowledging the roots of mental illnesses and substance use is social discrimination, inequity, and trauma. This strategy emphasizes the need to invest in families, in neighborhoods, and in communities for successful upstream and downstream measures. No one is unaffected by the impacts of mental health and substance use, and challenges persist, the ones that we know well, and they include the drug toxicity crisis, high living costs in a city like ours, housing accessibility, and the lingering impacts of the COVID-19 pandemic. And as a city, we must care for each other, creating community and building a city where our sense of belonging strengthens us all. I'm honored to represent some of Toronto's most vibrant downtown communities. I share that distinction with Councillor Moyes, and I know the importance of policy-based mental health and harm reduction supports and how they can build a safer, more inclusive Toronto. And this is the work that we must do together across the city. Implementation of this strategy requires a concerted effort from city divisions, so many of which are represented here, community organizations, also alongside us, healthcare partners, government agencies, and our federal and provincial colleagues. I cannot stress that enough. With dedicated staff from Toronto Public Health and a public advisory panel, we will keep this strategy on track in a practical way. At the city level, we will be convening an implementation panel to work alongside the Board of Health to ensure implementation of this strategy remains a priority, not only through the committed leadership given by Toronto Public Health, but by the city as a whole. In the past year, the city has taken important steps forward, such as last month's citywide expansion of the Toronto Community Crisis Service, where we have seen thousands of concerns involving mental health be addressed by trained social workers instead of involving the police. We know more must be done, and in a city like ours, we should all have what we need to thrive, and this includes affordable housing, access to supports, and a sense of community and belonging. That is part of the solution as well. By envisioning a Toronto free of mental health and substance use stigma, this strategy paves the way for accessible healthcare, services, resources, and community spaces. Our commitment to collaboration, excuse me, Our commitment to collaboration, understanding, and action remains steadfast, working together to make Toronto a city where everyone is supported, safe, and belongs. I'm very proud to be moving this strategy forward and for all of you to see it and be part of that change as well. Thank you very much.
Thank you, Deputy Mayor Malik. So as chair of the Board of Health, I'm thrilled to launch Our Health, Our City. This comprehensive strategy takes the holistic approach to addressing mental health and substance use challenges across all age groups and communities. Tragically, nearly 3,000 people have succumbed to opioid-related overdoses since 2015, emphasizing the urgency for comprehensive services, including harm reduction, treatment, and social support. Our Health, Our City outlines evidence-based interventions to save lives and improve health outcomes related to alcohol consumption, estimated to cost Ontario $18 billion in 2020. Key investments from all levels of government in health and social fabric are vital for creating a livable city. While challenges persist, every Torontonian should find representation and confidence in this strategy. Our Health, Our City is for all of Toronto, a city where everyone has the right to health and safety, linking health issues and community safety. Now I'd like to introduce Mary Madigan Lee, the City of Toronto's Chief People's Officer, to share a few remarks.
Thank you, Councillor Moyes. Good morning, everyone. My name is Mary Madigan Lee. I go by the pronouns she and her. I'm here on behalf of our city manager, Paul Johnson. As Chief People Officer, I take pride in supporting our health, our city, affirming mental health, public safety, and reducing substance use harms as core priorities for the City of Toronto. Witnessing senior leaders unite across the City of Toronto divisions to incorporate the strategy's recommendations into their programming and service delivery is truly inspiring. Mental health and substance use concerns touch us all, necessitating a collective effort. Addressing these issues is essential for maintaining Toronto as a vibrant and safe city for everyone. The strategy's recommendations encompass clinical and treatment services, aiming to bridge the gap revealed by the City of Toronto's Streets Needs Assessment in 2021. Preventing harms involves investing in children and families and neighborhoods, fostering resilience and coping mechanisms. Importantly, promoting mental health in the workplace is a key aspect, impacting organizational effectiveness, productivity, and overall health. As a Chief People Officer, I am committed to championing the implementation of the National Standard of Canada for Psychological Health and Safety in the Workplace at the City of Toronto. This work cannot be done in isolation. It requires the collective commitment of individuals, communities, businesses, agencies, and all levels of government. Join us in shaping a Toronto where the mental health and well-being of all residents are prioritized and substance use-related harms are diminished. Thank you.
Thank you, Mary. So the mental health of the City of Toronto employees is paramount, and I am delighted to see an enhanced focus on supporting their well-being. Now I'd like to introduce Susan Davies, the Executive Director of the Gerstein Crisis Center, to share a few words.
Thanks so much. So as the Executive Director of Gerstein Crisis Center here in Toronto, I am honored to be part of the launch of Our Health, Our City. This strategy provides robust recommendations to improve the mental health and well-being of all Torontonians. One notable priority within the first year is the development of 24/7 crisis centers. And Gerting Crisis Center, in collaboration with many other community organizations in downtown Toronto, has proposed a substance use crisis model encompassing 24/7 respite and stabilization, crisis intervention, short-term crisis beds, peer supports, and linkages to addiction medicine, so vital for our community. In Toronto, individuals in mental health and substance use crisis often can't access the supports they need, and they find themselves without support, especially after hours, which really can lead to detrimental outcomes, and as we know, unfortunately, including lives lost. Establishing 24/7 crisis centers would offer community-based, timely, trauma-informed harm reduction responses, reducing strain on first responders and emergency departments. This model is crucial intervention for individuals in crisis, connecting them to the essential health and social services that they need, and while fostering positive outcomes for both individuals and our communities. I eagerly anticipate the collaboration with the city to advance this much-needed intervention. Thank you so much.
Thank you so much. Thank you. Thank you, Susan. Thank you. And thank you and the entire Gerstings team for your tireless efforts and dedication to the well-being of Toronto residents. I share an anticipation for the establishment of the 24-hour crisis center. In conclusion, I extend my gratitude to all present at this press conference here today. As you can see, there are many people here today. It's a very important announcement. Together, let us work towards a Toronto where the mental health of every resident is prioritized and substance use-related harms are significantly reduced. That concludes our formal remarks, and we're happy to take any questions that you may have.
Councillor, obviously there are a lot of moving pieces to this plan, and so many of them rely on funding from the city has 1.5.
Yes.
How confident are you this plan?
I am feeling hopeful and confident that the province and the feds will see the work the city put into this, and they will come to the table. Again, it's not only the feds and the province, but also to hospitals are listed here, social agencies are listed here, and many city departments are listed here. So it's really all hands on deck, because realize that we are in a crisis situation and something needs to be done. And there are many MPs, all the MPs, I believe, in Ottawa are from Toronto. So they see the effects of what's happening on the streets of Toronto on a day-to-day basis. They are not immune to it. They have friends, they have family who are all affected by what's happening on the streets of Toronto. And I feel that they're in a good position to advocate on our behalf of the city of Toronto to ask for the most very important funds that are needed. Again, I know our team will go through that on November 27th at the Board of Health meeting, and those are good questions to ask there.
Along the lines. What happens?
We will continue to do a part as a city. Again, we have many hospitals who are on board. We have social agencies that are on board. We've actually started implementing some of these things through the 24 crisis line that we approved at council this past month. So we have shown leadership as a city when it comes to these issues. And again, I think, we lead by example. And again, I'm hopeful that the province and the feds will come to the table. Discussions are happening, and I'm hopeful by them. I'm not quite. I don't understand the question exactly.
Specific letter request that you are planning to fund this.
Well, again, it's a 5-year plan. So, the province of FES can give it to us all at once, or, they could add it into their yearly budget, right? But again, we're committed to it as a city. And as you can see, there are many people here who are in support of it. And I think down the line, you may get some good news from other levels of government. I'm hopeful. I'm optimistic. You have to be, right? What is the alternative? People's lives depend on it. Many lives have been lost already, and many more will be lost if status quo remains the way they are now. Well, we've done our part as a city to actually submit the application, as you know. But again, I want to emphasize that mental health and addiction is not a criminal, but it's a health issue, and that's the way the city deals with it, right? And Toronto Police and other paramedic services, we're all here. It's a health issue. It's not a criminal issue. And I think, we as a society, we've come to realize that. So regardless what happens federally, what we do here at the city, we will continue to do.
Fire and drive to the sea. Fire. She lives here.
Yeah, thank you for the question. Bikram Chawla, Paramedic Services Chief. It is something that we see on a daily basis. It is an alarming trend, as others have said before me. And it is something that when we welcome this strategy, we think it is very timely, and we look forward to supporting the city as it continues to implement the strategy. And we will be there to support the city at every step of the way. It is something that, as you mentioned, this is something that we see every day on the front lines. And our frontline paramedics and our dispatchers manage these calls every single day, 24/7. So this is very welcome news, and we're very much looking forward to it.
The implementation of a strategy like this helping with over the last couple of weeks, friends in the city.
This actually would help, I believe, because these types of calls would get the essential help that they actually need. So I think it would actually have a positive impact for our frontline staff, because these particular patients and clients would actually be getting the care that they truly need, that could really help them, 24/7.
Would that help specifically?
It is possible that it could have that sort of effect. We'll have to wait and see when the strategy actually rolls out, but that is a possibility.
As I've mentioned, that has not been the case. We're only rolling out the strategy now. And I've mentioned already that some aspects of this strategy have actually been implemented through the 211 service that we're expanding across the city. And again, Gerstein's here. I mean, they could probably speak to it a little more as to their role into this this plan, the strategy. You would like to make a comment around? Well, what you've been doing and how you're going to complement this strategy. Sure, just you're here and just speak to it.
Yeah, I am really encouraged to see us thinking about mental health and substance use issues as health issues and not as criminal justice issues. And we're starting to build a bit of an infrastructure that can actually respond to those calls in ways that I think is going to be far more effective than what we have been relying upon over the last number of years, really. And that does require investment. I think that, the beauty of 24-hour crisis response is is that there's accessible care in the moment when people need it, which is so essential. But we also know we need upstream prevention health services as well as post-crisis services that also need to be part of this whole picture. But without the ability to provide a health response in a timely manner, being able to move people into those kinds of resources is much more challenging. So it's very encouraging to see this happen. I think I'm very excited to think about the idea that we also will do this most specifically in a substance use scenario as well. We obviously already work with that at Gerstein Crisis Center on a daily basis, but having purpose-built and infrastructure strong enough to actually support the needs that are actually presenting is really what we are hoping for and excited to see the possibility. Thank you.
I mean, that's probably a question for Health Canada. You're very persistent in this question. Again, the city have actually moved beyond that, I'm going to say, in that we're actually, I'm going to say this out loud, but Toronto Police, for example, does not criminalize people who use substance use, for example. I don't believe so. Because the service among other city divisions have shown that, recognizes that, substance use is a health issue, not a criminal issue. And we're changing our thinking around that as a city and city divisions and all those who support us. So again, Health Canada coming into the picture at a later date is not going to change a lot of the things we're already doing here in the city. But to your point, we are waiting to see what comes back from Health Canada, right? So when you speak to the minister, perhaps there's a question you can ask. Well, again, the strategy is coming to the Board of Health on the 27th of November. And, we presented it here to the public, to you today. And when I do meet with my counterparts, we will discuss this because it is a priority to me and to everyone here today and the entire city. So I have not had the opportunity, but I will. Okay. Well, it is a priority to us. As I mentioned in the last council, we approved it. Gerstein is here, and we have Taibu in Scarborough, and other partners coming on board. We have established a 211 system and expanding our services there. We now have 4 emergency lines across the city, as you're aware of. And so those are all steps we've taken. And, it's those things actually mentioned in our Health, Our City document already. So we are already ahead of the curve. So it is a priority. And it will be and it will continue to be a priority. Even though it's a 5-year plan, it's the first of, I'm sure, many plans to come, right? But the reason we have this here is to save lives, right? Because we need to take action on it. All right, I think I'm done here. Thank you.